Greetings. My talk today is Constitution, an Evolving Paradigm in Traditional Acupuncture and its Elucidation by Pulse Diagnosis. So pulse diagnosis can act as a guide to treatment based on a person's constitution. And as far back as 1686, Michael Boehm wrote, "Only he who knows how to maintain and strengthen the connatural pulses to bring them back to their original condition will be able to maintain life and cure diseases." So there are several concepts in here we need to specify. One is connatural, which I take to be the same as what I'm calling constitutional. And the idea of bringing them back, you bring them back from something which is what I'm calling the condition. So you want to bring them back from the condition at present to their original constitution, their constitution. And that's what Michael Boehm thought Chinese medicine was about in the 1600s. And I think he was a lot closer to the classical concepts than many people are today. So part one of this talk will be how the idea of constitutional theory as it relates to pulse diagnosis has evolved, basically how are health and disease reflected in the pulse. The first paradigm that I'm going to bring up is from the Neijing, and this was one that is quite popular in Chinese medicine, that Earth is the center of the five elements, and that basically health is reflected in our acquired qi or zheng qi, which essentially I'll look at as the combination of yin and wei qi. And that's what's responsible for maintaining our health, and we have to replenish every day. Okay. So acquired qi manifests in the radial pulse, as it says in So-Wen 19. All the five zang are supplied with qi by the stomach. The qi of the zang cannot arrive by itself at hand tai yin. It's only because of the stomach qi that it can arrive at hand tai yin. In severe diseases, the stomach qi cannot arrive together with the perverse qi at hand tai yin. When the pulse is weak and smooth, then it has stomach qi. So the concepts that I want to focus on here are the idea that in the Neijing, the hand tai yin in So-Wen 19 was specifically mentioned as the place where you felt the pulse to determine whether it had stomach qi or not. So the idea of radial pulse diagnosis being a later development, which many commentators have held to, is not supported in my opinion. Okay. There's another paradigm, second one in the Nanjing, which may be either earlier or later, depending on whose viewpoint you follow. And this is based not on the center, but on the north direction, which is the water element at the base of the body. And this is where the Nanjing says we have our Mingmen, or gate of life, which is our inherited qi that is fundamental for health. So the Nanjing talked about this energy as the moving qi between the kidneys, otherwise known as Mingmen, or the root. Nanjing 14 says, just as a person has feet, a tree has roots. Even though the branches and leaves may wither, the roots can live by themselves. So a pulse is said to have root when the deep level can be felt clearly, and also when the chir position can be felt clearly. Here's a third paradigm, this one again back to the Neijing and the Ling Shu. It says that the fire in the south is responsible for our Shen, which is our spirit. And there are many passages that speak about the spirit as actually the basis for all of acupuncture. So, for instance, in Ling Shu 8, it says all norms of piercing require one to first consider the spirit as the foundation. And this shows up a lot later in Chinese medical history. Zhang Jiabin said, one who is good at pulse examination will particularly observe the spirit, not the form. And a pulse is said to have spirit when it's soft, but with strength, neither big nor small, and regular. So for myself, I find these definitions of what the pulses feel like as a little bit nebulous. It's not so easy to tell. And what I'm going to propose is that most case histories you come across, they don't talk about when they're doing pulse diagnosis that there's a problem with the stomach qi, or that the pulse doesn't have spirit, or the pulse is not rooted. They talk about the many other factors, but those three are not the most common. Okay, so we're looking at these three original paradigms, Yuan Qi, Zheng Qi, and Shen Qi. And some of them I think are constitutional, some are conditional. But if we ask ourselves, where did this model of the normal pulse come from? Actually, it's a rather late development, I believe attributed to Cheng Zhongling in the Qing dynasty, who said, there are tips for pulse examination. That is, only 3 words: stomach, spirit, and root are needed. Okay, so that's something that is a more modern way of looking at things, in my opinion. A fourth paradigm, which is often considered to be much more modern, is the idea of the 5 elements as being the most important part of assessing normality, which Worsley defined as the CF, the person's, I'm blanking now, causative factor. Okay, I call it the constitutional element. So this is based on passages in the Neijing and Nanjing. You can see that it's really present right from the beginning, but it's not elaborated. And this is Worsley's diagram of the 5-element cycle with fire at the top there, but actually any of the elements can be the top CF element. I wrote a whole book actually that half of which was devoted to tracing where Worsley got his sources from, and it turns out that they are really, for the most part, quite traditional. All right, so where did Worsley's chart come from? Well, Honma Shahaku was a Japanese member of the original Meridian Therapy group that was in the early 1900s, and this chart was published around 1927, and if you look carefully, you'll see that it's really identical to Worsley's chart. The only difference is in the color. It's not in color, and it's not a circle, it's a pentagram, but it's really exactly the same chart. And it turns out that Honma had already died by the time that Worsley began studying acupuncture, so clearly he's the prior person, but he himself must have been inspired by something earlier. And in fact, in the 19th century, this individual, Li Jima, in the late 1800s, developed a Korean herbal medicine system called Sasang medicine that was based on thinking from the I Ching. That have to do with the 4 images, or Sixiang in Chinese. And he said there are 4 basic constitutional types: strong lung, weak liver; strong liver, weak lung; strong spleen, weak kidneys; strong kidney, weak spleen. Okay, so that's Li Jima. And his idea was a precursor, as I think, of this Japanese idea of the 5-element cycle as being part. Now, Honma himself had written that he thought there were 20 different types of people, and that included either excess or deficiency of the 10 organs that have form rather than the unformed organ systems that we call ministerial fire, namely the Mingmen and Sanjiao situations. So those are not part of the Constitution. They are a separate system. But the 5 elements, 5 yang organs, 5 yin organs can each either be excess or deficient, forming 20 different types of people or constitutions. So how many are there? I don't know. This is one of my main Korean teachers, Kwan Do-wan, whom I studied with in the 1980s. And he developed a system called Korean constitutional acupuncture based entirely on pulse diagnosis, from which he concluded there are 8 constitutions. So we've got a whole number of paradigms of constitutional divisions. And how are we to make sense of them? Well, let's stay with Dr. Guan's idea for a moment because it's so radical. He had this constellational idea that every organ has not just the traditional role that you can find in any Chinese medical text, but in addition, it has a second role, which is only dependent on the relationship, it's a familial relationship between the organ itself and the person's constitutional organ. And this is quite radical. It's something that I don't think you can find anywhere in the prior literature. So I think he was quite a genius. And as I said before, any of the elements can be constitutional: wood, fire, earth, metal, and water, which is how you get the 20 constitutions. Let me go back a second. This is Worsley's chart on the left, but you will find lots of examples of having wood at the top of this 5-element diagram on the right. And I even have one here that I found from searching where water is put at the top. And I think that's just reflecting the idea that actually any of the elements can be at the top. It just depends what you mean by it. And for me, I like to think of the importance being the constitutional element. So how many constitutions are there? Depends how you parse it. You can have 2 by yin yang, you can have 3 by the Sanjiao, 4 by Li Jima's Sasang medicine, 5 by Worsley's 5 elements, 6 by the Yu Jing, or 6 major meridians. Actually, French teacher Yves Racania taught this as a constitutional level, the terrain of the individual, and you can keep going on and on. But eventually you'll get to 20, which is what Honma had taught. And I happen to agree with him that from my experience and what I'm going to present to you, there are only 20 identifiable constitutions by pulse diagnosis. And so that's what I'm going to try to expand upon. How do you diagnose a person's constitution? Part 2. The first way is using the Ren-Yin Sung-Gu system that the Neijing describes. And this is one of my other Korean teachers, Yute Woo, the originator of Korean hand acupuncture, who's teaching me this method of diagnosis. And basically, this is about the size of the carotid artery versus the radial artery at the 2 places called Ren-Ying in the neck and Sung-Gu at the wrist. Wang Bing, who is the collator of our extant version of the Neijing, said in So-Wen 7, if the pulses are equally big or small, as if a rope of equal diameter, one speaks of a healthy person. So that's in these 4 images in the diagram. The one on the left is equal neck and wrist pulses. But if one begins to be a little bit bigger, the first stage where it's a little bit bigger is what the Neijing calls either Shaoyang or Jueyin. Okay, so let's say that the neck pulse is a little bit bigger, and that means that it's either Shaoyang gallbladder excess or Jueyin liver Jueyin deficiency, yin deficiency. And both of them will produce the same Renyin Sunggu pulse. But what's interesting is that in treating people, the Neijing says, you can just use this pulse and give them the treatment, in this case, disperse 2 points on the gallbladder meridian and tonify 1 point on the liver meridian, and it will treat any problem this patient has. So it's not a question of what type of illness the patient has, what their other signs and symptoms are like, what their conditions feel like in terms of patterns. All you need is these Renyin Sunggu evaluations. And for me, that means this must be an element of the person's constitution, because you can treat it for any type of problem the person develops. Okay, so here we have a way of answering the question that naturally arises. Okay, so it's either, in this instance, let's say we're talking about that second picture I showed, either gallbladder excess or liver deficiency. How do you know which one it is? Well, the Meijing in Book 10 says there is a way, and it has to do with the architecture of the radial artery. If at Sun Guan or Chu, there's a deviation in the architecture so that the radial artery doesn't flow straight, it deviates either outside towards the thumb or inside towards the ulna direction, it will tell you what's going on, which of those two choices is the constitution. So if it deviates radially, that's the yang direction away from the center of the body, away from the pulse center of the arm. That's a yang direction, it's the yang organ, the gallbladder, which is excess. If at the so that's at the Chu position. If at the Sun position, there's a deviation, but it deviates ulnarly, which is into the center of the hand, which is the yin direction is into, then it's the yin organ, the liver, and it's liver deficiency. So just using those two pulse diagnostic methods, you can determine an individual's constitution if you're really good at these types of pulse diagnosis. So in the 1960s, in the 20th century, the teacher I showed you, Guan Duan, actually I didn't show him yet, sorry. Guan Duan, he's one of my main teachers, developed a new system of pulse diagnosis by using a position, a finger position that's further proximally on the arm than Sun, Guan, and Chu. So Sun, Guan, and Chu are 1, 2, and 3. He used positions 4, 5, and 6 more proximally. And the pulses he felt are the very deepest that you can feel as you just release pressure from the bone. And the second line down shows what you'll feel on the right and left side if the person has a liver deficient constitution. What you'll feel if you go to the third line down is what you'll feel if the person has a gallbladder excess constitution. This is how Guan took pulses, not a very good picture. So I'm going to show you one of me actually demonstrating Ayurvedic pulse diagnosis, which happens to use, coincidentally, the same 4, 5, 6 location of pulse examination. And again, both in Ayurveda and in Korean constitutional acupuncture, to determine the constitution, you use the deepest pulse right above the bone, whichever shows up first. And this is an example of me showing this on a patient. So in Ayurvedic medicine, we have two major areas. The deepest is what I've just been talking about, the constitutional level called Prakriti, or the more superficial level called the Vikriti, which is their current condition. And I like to focus here on the most superficial, which is the dosha subdosha level that I will get into later. But that has to do with the person's condition, not their constitution. Oh, but before I leave, what I want to say is, let's suppose that we did the two prior exams and we found that, let's go back here, that with the Korean constitutional acupuncture, it was this pattern, liver deficiency, and was corroborated by this, where the deviation on the pulse was ulnarly, also liver deficiency. So we know it's a liver deficiency constitution. So according to Ayurvedic medicine, we should find, to corroborate this, that the Prakriti or constitution is Kapha dosha. And I'm not going to try to teach you Ayurvedic medicine, but Kapha dosha is exactly what you will feel in someone with a liver deficient constitution. So it's a way of confirming. The more ways you have of confirming somebody's constitution, the more assurance you have that you're correct. Okay? So having established somebody's constitution by these various pulse methods, we can turn to figuring out what somebody's present condition is like, what the nature of it is. And I'm going to discuss three different ways. One is from the Nanjing, one is Ayurvedic, and one is from the Neijing. And let's get into that. So the Nanjing in chapter 5 talks about how to feel the depth that corresponds to the different elements, the wuxing of metal at the most superficial, fire a little bit deeper, earth a little bit deeper, wood going down, and water just above the bone. And it's described in terms of beams of pressure that you exert to feel the pulse. So let's stay with this example that we had from before of a liver deficient constitution. And let's make a further stipulation that the problem this person has is actually an excess of the lung. And this is not uncommon to have Kerr-cycle Shanke relationships where the weak liver is being attacked by the excessive lung, which is metal and wood, not cooperating properly. Okay, so what Nanjing chapter 5 says is, let's take the right hand and examine the pulses at Sun Guancha, but in the yin finger position, so that we're examining the lung, the spleen, and the pericardium. So normally examining the lung, you would expect the pulse to be widest at the most superficial 3-beam level. But what you will find is that that's not the case. It will be widest at the wood level, which is quite deep. It's very easy to make this distinction. They're not even close to each other. And contrary-wise, if you examine the pulses on the left hand, again, yin finger position, so it should reflect heart, liver, and kidney, you will find that the liver pulse, which should be deep down here, is actually floating near the surface at the 3-beam level. Again, radically different. So this is one of the easiest distinctions to make. And by this, we can confirm that this is a problem of liver and lung not coordinating with each other. If we want to look at it from that second method, the Ayurvedic subdoshas, the subdoshas are felt by where the pulse strikes each of the 3 examining fingers, and there are actually 4 places it can do that, but if 2 are the same, it creates a 5th place, which I've shown by my own research, and this is not something that has been found by anybody else, but it's reproducible by me, is that the subdoshas in 5 correspond exactly to the 5 elements, the Wuxing, of Chinese medicine, not Indian medicine, Chinese medicine. So I'm not going to go further into that, but we can use this same thing to show that conditionally, this individual, before I go on to that, has metal lung excess based on the subdoshas. And the final method of conditional diagnosis is again using the Renyin Songgu system from the Neijing, but in this case, we're not looking at the size differences between the neck and the wrist pulse. We're looking at the quality or shape of the pulse. So there are 2 possibilities that the Neijing mentions, Zhao and Jing. Nobody uses these terms anymore mostly, but they're the original ones from the Neijing. And there's lots of arguments about what they mean. If you ask anybody, they usually say Zhao is either rapid or rough. The rapid idea is that the pulse is faster than 80 beats per minute, means it's a Zhao pulse. And that was what was taught by the lineage master of the Japanese Jingei, the Renyin Songgu system in Japan. And other people think, no, it's more the idea of roughness that's important, but roughness is such a nebulous concept that I don't think it's very reliable. Whereas from my own experience, a concave pulse as you press down is a Zhao quality pulse, and a convex pulse as you press down is a Jing quality pulse. And I think this perfectly explains what it says in the Neijing. So chapters 5 and 6 of the So-Wen say that the meridians are like streams of qi that flow from the Jing well points in the feet up the body and eventually make a connection to their partner, same named meridian, of the hand branch. So for instance, the liver connects to the pericardium meridian through this collateral connection where obviously there's a change in the movement of qi. So at the Jing well point in the feet, the liver meridian has a very smooth pulse as it moves up the body. And then when it gets to, just like a river that goes through a narrowing, it becomes the rapids. And the pulse becomes both fast, because the same amount has to go through a smaller space, and it becomes quite turbulent, which is why people that go rafting have to be pretty good at navigating, because the water is quite turbulent there. And so that's where the fast and turbulent, rapid and rough come from in the meaning of the Zhao character. And the Neijing says this Zhao character means that you're dealing with a hand meridian branch, whereas if it's still smooth, it's a Jing or foot meridian branch. Okay, so problem is how to take the pulses at Sungguan and Shi. So here's a picture of an individual taking the pulses with his fingers adjacent at the index, middle, and ring fingers, very distally up to the wrist crease. And here's somebody else doing something quite different, where the fingers are spread apart. Their middle finger is apparently proximal to the radial styloid process. And you'll find even many more ways people position their fingers. So what we need is a standard for determining where to put your fingers. And I think that this problem really originated from a mistranslation and misunderstanding of what the Neijing said about the radial pulse. So we've all seen these maps that say that the Fu organs are, their yang organs are the superficial aspect of the pulse, and the yin organs, the zhang, are the deep aspects of the pulse. But and that does come from a passage that was translated from the Neijing. But I think it's a mistranslation. I think that it has to do with words like entering and exiting and inner and exterior. So in my opinion, what actually differentiates the Zong organ and Fu organ pulses is finger placement longitudinally, not depth-wise. So this is the Yang position for feeling the pulses that I use. And so I call it the Yang pulse position. It reflects the small intestine, the gallbladder, and the bladder on the left hand, as you see here. And the way you feel this is you put your middle finger right over the styloid process with the two other fingers adjacent. If you want to examine the yin organs, you have to move your fingers proximally so that the index and middle finger are actually on either side of the styloid process, still together, but you've moved proximally, which is the yin direction appropriate for a more yin set of organs, the Zang. And so again, the left hand, Sun, Guan, and Shi in the yin position are heart, liver, and kidney. Okay, so now we have a way of defining the constitution and the condition. How do we practice the acupuncture that teaches us? So let's say the condition that we're trying to treat is inflammation of a Zang organ, okay? So this can be many different conditions. Let's see, I think I have a slide here, yeah, that lists them. It can be kidney inflammation, nephritis, heart carditis, liver hepatitis, lung pneumonitis, splenitis, also some other things like chronic fatigue syndrome do fit this, and we could talk about that if there's time. So let's say, for instance, in somebody who has a wood constitution, then if their constitution is liver excess, you want to treat their grandchild, their grandparent, the methyl element, their lung, to handle any inflammation. Any of those ones that I mentioned will be treated by dispersing the lung and tonifying the liver. Okay, so that's if it's a liver excess constitution. If it happened to be a gallbladder excess constitution, it's actually a different protocol. In this case, you want to tonify the earth element, the spleen meridian, not the lung meridian. So this has to do with familial relationships, and you have to know, is the constitution a Zang constitution or a Fu constitution? Because the treatments will be quite different. But once you know that, anybody with inflammation of a Zang organ can be treated without any further diagnostic evaluation. So here are the protocols. I'm not going to go into them. They do use the 4-needle technique that my Korean teacher used, and he used what's called touch technique, where the needles go in and out, in and out, in and out in a fixed sequence with a fixed number of repetitions. And the whole thing just takes a couple of minutes. It's quite effective. Okay, so this type of pulse diagnosis that I call constitutional conditional acupuncture is effective for treating any kind of functional problem as long as you're accurate in your diagnosis. And my most recent book, which was published this year in 2022 in June, has over 50 case histories, some of them from my 3 workshops that I taught and held in China, starting in 2017 through 2019. And about half of these case histories, a little bit less than half, deal with cancer patients, which, as you know, are not the easiest patients to treat. And so far now, in the 3rd year of acupuncture treatment, these patients are doing much better than the prognosis would have predicted. And in fact, a number of them who are stage 3 and stage 4 cancer, so they're pretty advanced, have been told by their oncologists that they're cancer-free now, which is quite amazing. So this is all based, like with the Zang inflammation and with the cancer, the way I approach cancer treatment, it's based on the pathomechanism that is manifested in this type of pulse diagnosis. So I hope eventually all diseases will be identified as having specific pulse diagnostic criteria. This is the book I just mentioned and my email address. And so you can always contact me if you would like further information. And thank you very much. And let's end this sharing. Stop video. And let's go here. How do I end my stopping sharing? Go, and we're done.